So
Welcome everyone. I'm Dr. Boen. I work
Yes.
at Cosmetic Laser Dermatology, which is a cosmetic dermatology practice in San Diego, California. Today I'll be talking about acne and acne scarring using light and a laser-based approach. So first we'll go over what is acne. We'll go over light and laser devices for acne. Then we'll talk about acne scarring and then light and laser devices for acne scarring. So acne pretty much is the most common skin condition. It affects over 50 million in the US. It affects virtually 90% of adolescents, and it doesn't stop there. So acne continues through adulthood. And actually adult female acne is something I see every day. Men still have it as well. So it's not something that just stops in as a teenager. And so what is causes acne? So it's multifactorial, but basically the pores get clogged, either through inflammation, excess sebum production, inflammation, bacteria, and this leads to blackheads and also these like cystic red bumps. And even celebrities have them. And I have acne as well that you can still control. So let's go over the medical acne treatments. And I'm sure a lot of you are familiar. Some are over the counter and some are prescription. So first we start with our topicals, which are retinoids or retinols, and then a medicated cleanser such as benzoyl peroxide or salicylic acid. And then we go for antibiotics if those are not working. And usually we use either topical or oral minocycline or oral doxycycline. If you're a woman, you can also use spironolactone, which targets the hormonal component of acne. If all else fails, we do have another treatment called isotretinoin, also known as Accutane, and this has the highest cure rate of acne. However, it's sometimes not the most tolerable treatment. You have to come in for multiple visits. It's a 6 to 8 month treatment. Your skin is very dry, and so it is not for everyone. It is, I love this treatment. However, I understand if a lot of patients are hesitant to do it due to some of the side effects. Luckily, there are other approaches to help with acne, and I am a medical and cosmetic dermatologist, so I actually love combining the lasers with medical management. So a lot of times I will still have you on medical topicals or even oral medications, and then add on lasers, and then slowly reduce the amount of medical management if we are going through the laser approach. So if you're looking for a low downtime lasers to treat redness, some of the inflammation, I use IPL and Vbeam lasers. You usually need multiple treatments, 3 to 5, and you can't continue your acne medications. This is an example of a patient with back acne treated with about 6 sessions of the Synergy Vbeam laser. So our second laser and light treatment for acne is actually developed in our clinic. It's called Photodynamic therapy, and it basically targets the inflammation, decreases the sebum production and blood vessels. And it is a 3-part treatment. So first you put the photosensitizer, I use Amylose, on the skin. It gets absorbed by the oil glands. You let it incubate for 1 to 2 hours. So you're in clinic for a longer period of time. And then it gets activated by lasers and light. There is downtime with this procedure. It is 4 to 6 days. You must have strict sun protection, and you do have a little bit of peeling with it and redness. And you do need multiple treatments. This is not, there are unfortunately no one and done treatments. It's usually a series of treatments. And I've seen patients now like 5 years later, and after their treatment series, for some patients, their acne has not returned, which is amazing. Though acne is tough. As you know, patients who deal with acne, it may have calmed down a little bit, but you may get an occasional pimple here and there. So here is a little demo, and it's on my Instagram page at Dr. Monica Boen as well. So this is the photosensitizer. It's a clear gel, and I'm applying it on the entire skin. And then you have to wait 1 to 2 hours for the medication to be absorbed. And this is the Vbeam laser. So it also targets redness. So it'll help with the redness of the acne as well. And the IPL will help with reds and browns. And then we're also activating it with a red and blue light. So this is after at least 2 treatments of the PDT. And you can see even like the redness gets better faster after photodynamic therapy treatment. And so far she has been acne free, so I'm happy to hear that. So now the newest thing on the market is the Accure 1726 nanometer laser. So our clinic, we have been involved in the research behind this, and we actually had a clinical trial and have an ongoing clinical trial with this laser. So this took a while to develop because this is a special wavelength to target just the sebaceous glands in the skin. And so it shrinks them down so that you don't clog the pores as much. This is FDA approved to treat mild to severe acne. Luckily, the downtime is low, though you do need to numb the face as this, but there's no downtime after. In the studies, 82% of patients were clear of acne after 12 weeks, which is pretty remarkable compared to our other medical management treatments. It usually is not that fast. This treatment can be performed on all skin types, and our clinic is one of the first clinics in the country to have this new device. And so here is actually, so the next video I'm going to show you is one of the first videos out there of the Accure laser. This was our, we had this device due to the research department. So there's a special smart handpiece that delivers the energy. We get feedback tracking with the device. And basically we are hitting all the squares, we're treating the whole area. So we're not just treating the individual acne spots, but treating the whole area. As we know, there's sometimes subclinical inflammation in other areas of the face, and this way you get a full treatment. So now for acne scars. So we also enjoy treating acne scars because this can really be tough for quality of life for patients. A lot of times the acne scars, I understand it's very self-conscious about it. And so, and we treat them, make them a little bit better. You can see their confidence getting better. And it's really, for me, it's something I really love to treat. So the first thing we do is identify the acne scar type. So are the acne scars red? Are they hyperpigmented? And usually on skin of color patients, you'll see more of this hyperpigmentation post-acne that can be very long lasting. Are the scars tethered down? And is the acne scar indented or raised? If it's indented, it's called an atrophic acne scar. And there are 3 types of atrophic acne scars. There is the ice pick scar, which is a very shallow, deep scar. These are traditionally the hardest scars to treat. And then you have the rolling scar, which looks like a little bit of a valley. And then you have a boxcar scar that can be box-shaped or rectangular. And in the center is loss of tissue. And there's different treatments that you use for each scar type. So it's really important to know what you're treating, and then I will target the treatment to the acne scar type. So the problem is that there are so many lasers on the market for acne scars. So it's very confusing. And a lot of times patients don't know where to start. So at our clinic, we do have over 40 lasers that we can use, but I'll focus on the 3 main ones that I have found to be the most helpful for acne scars. And of course, I'll always tailor for your individual treatment, but since we have so many and limited time, I will just focus on the 3 most popular ones. One is the non-ablative fractional laser called Fraxel Dual Restore. The second one is radiofrequency microneedling. We have Potenza and also Intracell. And laser resurfacing, which is our CO2 and erbium YAG laser treatments with AccuPulse, UltraPulse, and Cyton. But combination treatments usually work best. So I might use one laser, one treatment, and then switch to a different modality, or I might combine some on the same treatment day. I also may incorporate subcision or fillers. So this is really a multimodal approach because the scars are so varied, and it's important to see what works for each patient. So the first one is the Fraxel Dual Restore. So this is a non-ablative fractional laser. So not all of the skin is treated, and this allows you to have less downtime. It works by remodeling the scars and stimulating collagen production. There's less downtime than the more aggressive lasers, 2 to 4 days. You'll be a little bit sunburned looking red, and maybe a very, very mild peel. And usually you need 3 to 5 treatments. And you only need to do topical numbing for this treatment. So it's a rolling device, and as you can see, you'll be a little bit red for a few days after. But the treatment, we do cooling air and numbing. So the treatment is actually very more comfortable than it looks. And these are some of the results after a series of treatments. So our second laser is the Potenza Laser. So this is a radio frequency microneedling laser. So it has a variety of little needles on each tip, and at the end of the needle is a radio frequency energy that delivers heat to the scar as well. So it works both ways, mechanically remodeling the scar and also delivering heat to help as well improve the scar and collagen production. The downtime is 2 to 4 days, similar to the Fraxel. It is mild, and usually multiple treatment sessions are needed. And luckily, this one can be performed on all skin types. And so it really is good for skin of color patients who have acne, who worry about hyperpigmentation after laser. I've noticed this is maybe the best treatment in that category. And this is actually a special tip as well, that you can infuse a biostimulatory agent or filler into the scars as well. And so that is also one of the newer technologies. You can incorporate these combo treatments on the same day. So laser resurfacing is probably one of our most aggressive treatments. And this we perform in the OR. So for this treatment, the face is completely numb. And the CO2 and Erbium laser remove layers of the skin on the acne scars, tighten them, and also stimulate collagen. Though there is more downtime for this. So the downtime is 7 to 10 days, and we have a special protocol on how to care for the skin afterwards, but you need less treatments. It is 1 to 2 treatments, and you also get very good skin quality improvement. So these are patients with perhaps more severe scars who would want a more aggressive treatment. This may be the treatment for you. And so this is an example of the Ultra Plus CO2 laser. And you can really kind of etch out those scars to make them more invisible. So now I'm going to go over frequently asked questions, because I get these questions a lot in clinic. So when should I start my acne scar treatments? I say as soon as possible. When most of the acne is clear, you can start your treatment. Also, if you are on isotretinoin, you can start your acne scar treatments right after you finish your isotretinoin or Accutane course. You do not have to wait a year. That was previous literature, but new literature have shown there are no risks to starting right after. How many treatment sessions do I need? It really does vary on your acne scar severity, but I would say 3 to 6. However, the more sessions, the better results. And they're usually spaced a month apart, sometimes more, depending on skin type. And then, will my acne scars ever look like regular skin? Maybe. However, a scar is hard to make completely normal. We can improve their texture, and they can be much less noticeable, to the point of perhaps only you will know what they are, but it is hard to completely reverse that scar. And then, can I continue my acne regimen during acne scar treatments? Yes. The only thing you may have to stop is topical retinoids or retinols for some treatments, but otherwise you can maintain your acne treatment so you don't get acne on top of your acne scar treatment. So in summary, there are other ways to treat acne other than medical management. I do both. You can do IPL or Vbeam for milder treatments, but you may need more sessions, and to combine it with medical treatment. Photodynamic therapy can be used as a solo treatment or in combination with medical treatment. And the Accure laser is the newest innovation on the market. There's Accure and one other that uses the 1726 nanometer wavelength to really target the sebaceous glands. And there's even 2-year data showing that the acne has not returned. So that is really remarkable. And I hope it is as good as isotretinoin. The data is promising, but we'll have to see how this develops. And luckily, there have not been any side effects from the laser and not too much downtime afterwards. And it's very exciting, and we're very excited to be one of the first clinics to have this laser. For acne scarring, there are a lot of lasers out there. There's a Fraxel, Potenza Laser Resurfacing, and others. I went over 3 today. 2 have not too much downtime, and the last one is a little bit more invasive. And so I will tailor your treatment to you. Well, I hope you enjoyed this webinar. I hope it was educational. If you would like to follow up on Instagram or set up a consult, the information is here.
Great. Thank you so much, Dr. Boen. I can't believe it's only 5:20. We just had like a whole lesson in acne and acne scar treatments and heard the latest in such a nice, concise manner. Thank you. So you guys, this is the time for open question and answer. Even though Dr. Boen already asked herself some of the most common questions, I am sure there are a few more from all of you. So if you want, could you take a screenshot of what's up on the screen? And I will also pop it in the chat. And otherwise, I'm going to stop her sharing so you can see Dr. Boen a little bit larger while we are up here answering questions. Okay, great. So, and we are going to do the raffle. So please stay tuned until the end of the webinar. So here's the first one. Will shrinking the sebaceous glands with Accure result in dry skin or facial aging?
We have, since this is already, we've had isotretinoin, which we've had longer term data on, and we haven't seen any premature aging in those patients. So then we hypothesize with these newer lasers out there, this will not be the case. And from the newer laser, the glands shrink, but they do regrow over time. They're not completely destroyed. They will just be a little bit reduced. And those glands were probably overactive to begin with, which is why the acne has developed. And this is a photo of my husband and toddler enjoying Hawaii. This is her favorite way to hike.
That one, I took it down off the screen, but all right. Is one acne scar treatment better than another for those with deeper or olive skin tone?
For olive skin tones, you could do either laser. The deeper ones probably will have to do a combo of, I would do maybe the microneedling radiofrequency laser and perhaps a filler to then at the end fill those scars. Because sometimes it's not enough to remodel them with a laser, you have to actually fill some of them. So I do that with either a Sculptra or a hyaluronic acid, like Juvederm Restylane-based filler.
Okay, so just as a reminder, you guys can pop in questions now. All right, so how soon should you start treatment? Should you wait until the active acne is gone before treating the scars, or do you treat them at the same time?
I would say if we have like 10 to 20% of acne left, you can start treatment. If it's more than that, I would like your acne a little bit more under control before we start the acne scar treatments. Because otherwise then we are kind of getting into this, the acne is causing more scarring. So I think it's most important to treat the acne first.
Got it. And so which of these modalities would treat the acne first before you start addressing the scars?
Usually I would probably do, depending on severity, probably start with photodynamic therapy to calm everything down. And then after a few sessions of that, and that treatment will also get rid of some of the redness and browns that form from acne. And then we can transition to the acne scar lasers. Yes.
And I can personally vouch for PDT. Dr. Boen did 2 treatments on me and my skin cleared up tremendously. It's kind of crazy how
your skin looks great.
work magic. Thank you. Okay, so does retinol need to be stopped for any time period before acne treatments?
Usually I say stop the retinoid 5 to 7 days beforehand, especially if you're one of these patients who get a little bit of skin flaking or irritation, you may have to stop 7 to 10 days. If not too much irritation, 5 days is sufficient.
Got it. This is a great question. Can you do these treatments for the back, or I guess any other place on the body?
Yeah, back acne is so common. A lot of we see tons of it. It has its own like hashtag on Instagram, TikTok. So you can do these treatments on the back as well. Usually for the back, I'll do either IPL or Vbeam. It is a little bit more tedious to do the other treatments, but the IPL and Vbeam and Synergy lasers work really well for back acne.
Got it. Which laser is the most effective for hormonal acne, and will it help with minimizing pores?
I think the Accure laser and the PD photodynamic therapy is probably the most effective for the hormonal acne. We've noticed that we use the agent spironolactone to control hormonal acne, and we think maybe it works because it just decreases that sebum production or oil production. And so the PDT, photodynamic therapy, and Accure lasers decrease that oil production and may have a similar benefit to anti-hormonal agents. And especially because you can only use them in women. So now we have more treatments for men and women.
Got it. And how about, do any of these help with minimizing pores?
Yes. So for photodynamic therapy, we have noticed the pores have decreased from the lasers. And on the Accure, there's some prelim data that show very convincingly that the pores have also decreased in size. Though I will say for pores, I could do a whole nother lecture about pores. There's a lot of questions about pores. It is an anatomical structure. It's hard to shrink completely. It'll still be there, but there are ways to minimize it by decreasing oil production, boosting collagen around the pores. And so these treatments, the Accure and the photodynamic therapy, can do just that.
Got it. That's great. Okay, here's a detailed question. My daughter is 17 and she finished her isotretinoin treatment in October. Her results on her face are fantastic, but she has quite a bit of red inset scarring on her back. Which laser might you recommend for that? And do you know how many treatments she might need?
For the back, I would probably do, depending on your skin type, I do a combo of the Vbeam laser with either a Fraxel Restore or Potenza for the back. And for the back, the back needs a little bit more treatments than the face because you have to be less aggressive. There's less sebaceous glands. So between 3 to 6 treatments. But I've treated a lot of backs, and even getting some of the redness out just gives the teens like a huge confidence boost.
Got it. And being that she finished her Accutane treatment in October, would this be an appropriate time to start treatment?
Completely fine. You can actually now, the newer data has been out in multiple consensus papers over the years, have shown that you can start laser treatments immediately after isotretinoin.
Wow, that is great. And she's asking if there's any topical treatments she should start before she sees you.
I know. No topicals have been shown to improve scars other than retinoids, but that one I wouldn't use on the back.
Yeah. All right. Can you do any of these treatments while you're pregnant or trying to become pregnant?
Oh, no, I know. Unfortunately, you can do most of these treatments. You can do some treatments while breastfeeding. However, during pregnancy, because there are no studies, we cannot do them during pregnancy.
Yeah, understood. I will say that Dr. Boen did an entire webinar on treatments that can be done around, during, and after pregnancy. So I might point you there to our website because there are some things you can do. Dr. Boen found them for us.
Totally. I know it's a tough period. You're so limited. But once you can do a lot of stuff while breastfeeding.
So is there a good treatment for white acne scars?
White acne scars, great question, are very tough to treat. There is a newer treatment now using Lattice with the laser to help improve. So there is possible now. It will take a little bit more treatment sessions. It may not be completely back to normal skin, but it is possible now to darken those hypopigmented acne scars a little bit.
Wow, that's so cool with Latisse.
Latisse, yeah,
Oh my
using a
gosh,
side
will
effect
you
to
remind
treatment.
everyone what Latisse
Yeah.
does here?
Latisse, so Latisse is an agent you probably heard about. It helps grow eyelashes. However, they've noticed a side effect of that is you can get some darkening or hyperpigmentation if you use too much. So now we use it to help these hypopigmented or white scars.
That's so unbelievable. That's cool. Um, so why is the CO2 treatment done in the OR? Is that common for a fractional CO2 treatment?
Yeah, we just you have to have a sterile field. So we just like to keep everything sterile. And then there's certain procedures you have to do and certain smoke evacuators. So we like to have it all in one room. And we have a dedicated OR staff who does this more complex treatment so that they can help you with the aftercare. And actually, we very like it. It's having this dedicated OR team who does these procedures every day is very helpful for patients and for us.
But there's other practices out there that do the same lasers and they don't do it in an OR, right? So what's the...
Yes, yeah. And the other benefit of doing the OR is sometimes the laser resurfacing can be a little uncomfortable. So we do offer some mild pain medications and monitor patients, which we're able to do during the OR. But there's no general anesthesia. These are all done awake. However, in the OR, we can make you a little bit more comfortable.
Yeah, so it's definitely a big benefit that CL Derm has that. And
Yeah.
Dr. Boen does some of these treatments in the OR and some out. So we have options. All right, I think this might be the last question unless anyone else has one to input. But do any of these treatments impact facial hair? I had laser hair removal and electrolysis, and I would hate to regrow a beard.
Yeah, don't worry. Luckily, none of these will remove or grow hair.
Well, that's easy enough. All right, great. So I want to remind everyone that Dr. Boen does have availability, and even though our office is now closed, you can go to our website and book a consultation with her to sit down and really talk and see if you know what she would recommend for you and your unique situation. And Dr. Boen has a lot of tricks and tips up her sleeve between all of the devices we have at CL Derm. And of course, all of our doctors at CL Derm offer these amazing treatments for acne and acne scars. A lot of people are saying thank you so much. And yes, I agree. Thank you, Dr. Boen. This was immensely helpful and educational. And there is so much misinformation out there about acne and all these like magic potions that you see on Instagram. It's just so great to hear it straight from you as it is. So thank you.
And we have this year, we're going to have a lot more reels too on my Instagram and our Instagram page, just because there's too much information out there. There's too many lasers. We're going to try to distill it and make it more accessible for everyone. Because if you're not in this field, you don't know, and there's too many things going on. So my goal is to make these treatments more accessible for you guys.
I love that. And I put Dr. Bowen's Instagram handle in the chat. So please make sure to follow along. And of course, also follow Cosmetic, let's see, I can type at the same time, Cosmetic Laser Dermatology on Instagram. And otherwise, we are going to be running the raffle, and 2 attendees are going to get a free acne scar or acne consultation. And 2 attendees will win that. So we will review and announce that tomorrow, just for HIPAA concerns, and make sure everyone's okay before we announce their name. But otherwise, I think all of you that tuned in tonight have a good chance. So stay tuned for tomorrow. We will be reaching out. And thank you again so much for tuning in. Thank you, Dr. Boen. And
thank you guys.
I really hope that this can help some of you. And we wish you guys a good night. Thank you.
Bye, guys. Thank you for viewing.